Okay, good evening and good afternoon, everyone, and welcome back to our um, Orbis Future Vision Leader Speaker Series. And thank you so much for joining us for today's topic. Before I get started, I'm just noting that we are going to record the event for those who are not here who would like to watch it later. And then I'm happy to introduce myself. My name is Claire Zalay-Timbo. I'm the Technical Advisor for Gender and Special Projects with Orbis Canada. And I'm so excited about tonight's session and our incredible speakers. I would like now to introduce Mesa Rahman from Vision for All at Toronto's Metropolitan University, who founded Vision for All with her co-founder and who sparked this idea for this session. So Mesa, over to you.
Hi guys, my name is Maisa, and I'm the co-founder of Vision for All and also a biomedical sciences student at TMU. And yeah, I'm just super excited for today's session and to just learn from our guest speakers and for all of our attendees to gain some more knowledge on this topic. So yeah, hope you guys enjoy it. Okay, so I would like to begin this event by acknowledging the Indigenous people of the lands that we're on today. While we meet on a virtual platform, I would like to take a moment to acknowledge the importance of the land on which Orbis Canada calls home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our understanding of local Indigenous peoples between nations and their cultures. Today, Orbis Canada is located on traditional lands of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And this meeting place is still the home to many Indigenous people across Turtle Island. We come with respect for this land that we are on today and for the people who have and do reside here. So today's event is a collaboration between Vision for All TMU and Orbis Canada. Vision for All is a new student-run organization at TMU. I co-founded Vision for All along with my good friends and colleagues, Sanjana Bhandari and Shrika Rasakumar. We found that our university community did not recognize the importance of vision health and the inequalities in ocular healthcare. So by founding this club, we were able to start raising awareness for these issues and supporting students in our community who are struggling with it, as well as raise funds for organizations that support the same cause. So today's webinar will discuss the importance of eye health in Canada and globally and how students can get involved and support the efforts.
So tonight we have some incredible guest speakers who are here to talk to you about ophthalmology and eye care, both internationally and also locally in Canada. They will talk about their experiences working on addressing avoidable blindness and low vision and the approaches that their organizations utilize and how volunteers are a critical part of their efforts. So following our initial presentations by our presenters, we will host a Q&A period. So please save your questions and you can engage with our speakers directly. And then we will be having another short presentation on how to get involved in volunteer opportunities locally. So over to you, Mesa.
So without further ado, I want to introduce our incredible guest speakers for tonight. We have Katie Judson, the program consultant from SAVA Canada, Bianca Giacolone, Senior Manager, Clinical Performance and Standards at Vision Loss Rehabilitation Canada, Aisha Diop, Director and Program Management at Orbis International, Diana Rosales, Director, Community Engagement and Inclusion at CNIB, and Larissa McKnight, Specialist Volunteer Engagement and Strategic Projects at CNIB. So our first speaker this evening is Katie Judson. Katie holds a MPH and has been working in global ophthalmology since 2011. She is a program director for SAVA Canada and is adjunct faculty in the Department of Public Health at the University of Puget Sound. In her spare time, she enjoys going hiking with her spouse, knitting while watching reality TV, and has recently started fostering kittens for her local humane society. So please welcome Katie.
Hi, thank you so much for the introduction. It's true, cats like rule everything around me right now. I've got 10 of them in my house. So if you can go to the next slide. So Thanks for joining us. I'm Katie. I'm with SAVA Canada. We have a small but mighty team of about 6 people. We have an office based in Vancouver, so on the West Coast. So if you can go to the next slide. Our mission is to restore sight and prevent blindness in low and middle income countries. Next slide. So I wanted to give a little bit of context for why we do what we do before I get into like the what and how. So I don't think I realized that yeah, thank you. That is supposed to be full of things. Thank you. So first, I just want to talk about sort of the global disparities in vision and eye health. So who is affected? There are over 1.1 billion people worldwide living with vision loss. 55% of those are women and girls, and that's not because of any genetic change that makes vision loss more prevalent in women and girls. It's simply because of barriers to access that women and girls face. 90 million of these people are children, and 90% of these people live in low and middle income countries. So just to give you sort of an estimate, the WHO recently released a report that said only 36% of people, so only about a third of people with distance vision impairment have gotten the treatment they need to fix that, and only 17% of people worldwide who are living with cataracts have gotten the chance to get surgery to have better sight. Next slide. So where do we work? So SAVA works strategically in some of the places in the world where the prevalence of blindness and severe visual impairment are the largest. So that would be in sub-Saharan Africa, in West Africa, and in South and Southeast Asia. Next slide. So what are we trying to do? What is SAVA Canada trying to do to fix this issue or try to support this issue? We really focus on something we call community ophthalmology. And community ophthalmology is really thinking through like the public health aspects of ophthalmology. So looking at populations and understanding and developing programs that will serve entire groups of people, entire communities. So we do that through 2 aspects. One is universal access. So making sure anybody who needs care can get it, regardless of barriers that they face. And the second is focusing on sustainability. So finding ways to ensure that these programs can outlast anything that we might be able to provide or support. So next slide, please. So the first is universal access. So this means creating programs that break down barriers that people face in order to get care. So a lot of times this looks like supporting government eye units that wouldn't otherwise have the means or support to go out and find people who live far away from the eye unit and getting them to come in and receive services that they need. So this is working with local ophthalmologists from their own countries, and helping them develop programs that will serve the entire community. The next thing we focus on is gender equity. So all of our programs divide their data by men and women so that they can look and understand whether or not they're reaching women, and then do programs that will help bring more women and girls in the door. And the last is pediatric outreach. I'm sure as many, if not all of you are aware, pediatric services are inherently more difficult and more expensive, just because they require more specialization, more specialized equipment, and long-term follow-up. So SAVA Canada is committed to making sure that children can get the sight restoring services that they need. Next slide. So just a quick example of one of our gender equity programs. So working with our partner in Sub-Saharan Africa, the Kilimanjaro Center for Community Ophthalmology, they go out and train women's microfinance members in how to identify vision loss. So why these particular women and these particular groups? So they are very well known in their community, these women, and in order to make a living, they have to interact with and know almost everybody in their community. And they do this on a regular basis. So with this vision loss training and how to identify people with vision loss, they can go around and see people in their community, see who needs to be seen, and refer them to an outreach that's going to be happening in their community. So as a result of these trainings, almost half the people who come to the outreach activities have been referred by these women, and the number of women and girls coming to these outreaches has increased by more than 15%. Next slide. So the other thing we focus on is sustainability. And this is really to ensure that these programs can outlive anything like a grant or funding. So this is ensuring that people in their own communities have the ability to have the training they need to provide their own services. So we focus on things like providing training for ophthalmologists through subspecialty, all the way through program management training to orthoptists, to refractionists, all those types of opportunities. We also help to make programs financially self-sustaining through a subsidized model where people who can afford to pay subsidize services for those who cannot. We also work with teams on high quality, so working on quality improvement programs to improve the quality of services offered, and then also operational research and development support. So if you go to the next slide. So this is sort of the last thing I want to leave with you is just sort of our evidence and practice program. So this is where we utilize experts in community ophthalmology research and program design to increase the quantity and quality of services offered. So right now we're working with several leading experts in this field in India, where they are working with various hospitals to provide them with the skills they need to look at their own data, understand their own data and what it's telling them, and how to make program improvements for the hospital based on that data. So it's a way to sort of build within the institutions themselves ways to sort of do that kind of continuous improvement and quality improvement, which I'm sure if you haven't already had classes in that, you will at some point in terms of hospital administration. So that's just a few examples of what Save Canada can do, and I will hand it back over to Claire.
Thank you, Katie. So our second guest speaker for tonight is Aisha from Orbis International. Aisha is the Director of Program Management for Global Programs and is based in New York. Aisha is a health program manager with over 20 years of experience in program planning and implementation, research, and training facilitation. Her interest in public health stems from the belief that everyone is entitled to receive equal and equitable access to healthcare. With field experience in over 15 countries in Asia and Africa, her career has focused on improving access to and quality of services for women, children, and vulnerable populations. So please welcome Aisha.
Thank you, Maisa, and thank you, Katie, for giving us really good background and context for this session. Really highlight the need for much of the work that we're doing, and it's a really nice segue for what I'm going to share today. So thank you. I am pleased to share some of the work that we're doing at Orbis to combat preventable blindness. And in particular today, I'm going to focus on our efforts around low vision and give you a few examples. You can go to the next slide. So today I'll just use some of the time we have to talk through some examples of what we do at Orbis using 3 different approaches from 3 different countries. Can go to the next slide. So as you might know already, at Orbis, we work to transform lives through the prevention and treatment of blindness You might be familiar with some of the different approaches that we use, including our work in Flying Eye Hospital, our CyberSight platform. But the examples I'm going to share with you today come from countries in which we have active long-term projects and presence. And so here, this map is just kind of showing you or giving you an overall glimpse of where we work in our country programs. Of course, our reach with CyberSight and other activities is farther reaching, but this is where we actually have country program presence, and we're able to build on the long term. So next. So the first example I have is just share a little bit about the work that we're doing in Ethiopia. So Orbis Ethiopia, our team there is implementing activities that focus on the reduction of blindness and low vision due to cataract, trachoma, and untreated refractive error. And this is part of childhood blindness reduction projects in southern Ethiopia and northwest Ethiopia. So the main activities that we have there center on either developing new services or strengthening existing ones. So through this project, we've established 2 fully equipped child eye health tertiary facilities at the 2 referral hospitals. So that means that we've built it out to train pediatric eye care team and set up wet labs to support with the postgraduate training. Where there are already existing facilities like the secondary eye care unit, the general hospitals, health centers that are in the same catchment areas, we're working to build service delivery capacity and then strengthen the referrals between these sites to increase the access to services. So a lot of this is done by providing training, equipment where it doesn't exist, or consumables to these facilities. Because these existing facilities might need to upgrade, but they also, in terms of equipment and their facilities and their staffing, but they need this capacity because they do play an important role in the communities in helping to find and identify children with eye conditions in the community, other people in the catchment area that might need more care. So building up that secondary support, that support at the secondary and primary levels is also really important. And then as far as the training that Orbis supports, it includes a wide range of eye health personnel, including the ophthalmologists, the nurses, optometrists, biomeds, teachers, community volunteers. So all with the aim of kind of strengthening the eye care services at all the levels. And a lot of these trainings are conducted with the support of our large base of volunteer faculty, either in person or sometimes remotely. And then the last thing I wanted to mention here is that the important piece of this is ensuring that we're improving the actual service delivery. We're also creating increase in demand from the community. So there's an important education piece around eye health knowledge, around childhood eye conditions, and this is done through local media and radio messaging, different phone messaging, and other ways to communicate in the community. So this advocacy piece is an important part of building up and increasing access at the tertiary level from the bottom to the top. So the next slide. So a little bit why these types of activities are important and what is the context that we're working in. We do know that the large majority of low vision and blindness cases are either preventable or treatable. So we have, we're working in a context where we have human resources that might be limited, facilities that might not be, that might need to have their capacity built to properly care for the populations. We also, from IEPB and WHO, the recommendations that say that there should be at least 1 child eye health tertiary facility per 10 million people in developing countries. Ethiopia, for example, only has 3 with the population of 123 million. And 2 out of those 3 were established through these projects. So there's really a clear need to to build the capacity to train providers, equip, build capacity, and improve the services for these treatable eye conditions, including those that cause low vision. Next slide. So the next example I'll touch on is a one in Bolivia, project in Bolivia, where we're working to improve the service quality and access to eye health services at the National Institute of Ophthalmology, also referred to as INO in Bolivia. And we're working to directly strengthen the capacity at the low vision department there. And so this project, in addition to capacity building, we're also focusing on reducing cataract amongst the elderly population. Is the largest referral hospital, and it treats about 40% of the country's population. It has its own low vision department, and that serves about 500 patients a year. So just some of the activities and some examples of the things that we're working on. The focus on low vision. We're working with ophthalmologists, nurses, and residents to enhance their diagnostic and treatment skills in addressing low vision conditions, equipping low vision lab with optical aids and devices to treat patients with low vision. And there's also a lot of work that's being done around improving residency training in the field of low vision treatment. So now they have new curricula and equipment that really supports their training needs. Another important piece that we've been working on is to increase gender sensitivity among the medical and administrative staff so that they can provide high quality, gender sensitive healthcare services. So we've done a number of activities and trainings and targeted interventions around this. One of the things that we did was a regional training competition around gender between sites. So really trying to be more intentional about the work around gender in this particular instance. You can go to the next slide. So at the pathologies that cause low vision are age-related macular degeneration, glaucoma, diabetic retinopathy, high myopia. So really just to give the context where this work was started within the context of low referral rates for low vision, as most ophthalmologists and residents, they hadn't been trained in low vision. So since they aren't trained, they didn't know when to refer. So really supporting this low vision department is in line with increasing access to services and meeting the needs of the population. You can go to the next slide. Yes, so I just wanted to share a little bit about a project that is in the works. It's a project in China. And so it's a part of a refractive error project, and Orbis China is exploring a multi-sectoral rehabilitative model for low vision and other disabilities. So it's really kind of a first step in exploring how to provide more services, as low vision is not usually part of the scope of work in these hospitals. Some of the activities you can see there, but we're working really to kind of equip a low vision resource and educational center that'll provide rehabilitation services. And then of course there's training and a lot of collaboration with different organizations, particularly because there's only one organization that is providing low vision services. So you can go to the next slide. Just again, why it's important in terms of the context and why we're doing this work. Myopia rates are really high in China. Just an example, for 6-year-old kindergarten children, it's 1.5%, and that prevalence goes up to over 17% for children in middle school. So the national priority is still focusing on myopia control and treatment, and more Orbis is working with government and different hospitals to incorporate low vision and making sure that that's being addressed. Can go to the next slide. And just to finish, I just wanted to share that there's a recent published study that's named in this title. And this one highlights the importance of the work, particularly for children. It's a systematic review and a meta-analysis of the links between the quality of life in children and vision impairment. So based on the review of previous research, that this paper is showing that there's a clear link between children's vision and mental health. So kids with low vision, especially due to myopia and with strabismus, are at much increased risk for depression and anxiety. And on that flip side, surgery to correct strabismus significantly improves symptoms of depression and anxiety in children. So just wanted to share that that's available, that publication is available, and I'm happy to share that. And with that, I will conclude my talk and hand it back over to Mesa. Thank you.
Thank you, Aisha. So our third speaker for tonight is Bianca Jackalone from Vision Loss Rehabilitation Canada. So please welcome Bianca.
Thanks, Meisha. I'm super grateful for the opportunity to share an overview of Vision Loss Rehab Canada and what we do. We're often referred to as VLRC, so you'll hear that throughout my talk tonight. But Vision Loss Rehab Canada is a not-for-profit national healthcare organization and the leading provider of vision rehabilitation services for individuals living with vision loss in Canada. Annually, we receive more than 8,000 new referrals and provide direct service to more than 35,000 Canadians of all ages from coast to coast, with the exception of Quebec. We have a staff of 270 certified specialists who deliver client navigation and vision rehabilitation services to all of our eligible clients. And services are offered through telepractice or in person at the client's home, local community settings, or within one of our 44 clinic locations across Canada. Our rehab services help Canadians with vision loss accomplish activities of daily living and living safely and with confidence. So our services are tailored to the unique needs and goals of each person who comes to us for help. And just like every person who experiences vision loss does so differently, so are their rehab goals and related treatment plans. So while one person may need help with basic daily living tasks like pouring a cup of coffee or preparing food safely, others may want to attend university, pursue a new career, or start a family. So client rehab plans are tailored to the individual's level of vision loss, their goals, and are generated from the results of specific competency assessments. Our rehab services are delivered by highly skilled teams comprised of client care navigators, certified low vision therapists, certified orientation and mobility specialists, certified vision rehab therapists, occupational therapists, early intervention specialists, and assistive technology specialists. So just to speak a little bit more about our programs and services, every client journey within VLRC begins in client navigation. So our client care navigators guide clients not only through internal services within our organization, but they also support the connection to other social and healthcare services that the client may benefit from when it goes beyond our internal scopes of practice. So after an individual is referred to VLRC, either through ophthalmology, optometry, another allied health professional, or through a community or self-referral, they're matched with one of our client care navigators. They then conduct a fairly comprehensive intake assessment, learning more about the individual's vision loss, their needs, and personal goals. And then together with the client, the creation of a rehab treatment plan begins. And the client care navigator then connects the clients with the specialists and services they need to achieve those identified goals. So throughout their journey with VLRC, the client can reach out to their designated client care navigator at any time, really to initiate new services or reevaluate their current treatment plan. We have a tiered approach to service delivery, which begins with primary service. It's really the first line of support for our clients who have a level of functional vision and is delivered by our certified low vision therapists. So primary service provision focuses on functional needs. They target primary short-term goals for independence, using residual vision for daily tasks like reading medication labels, pouring liquids, and basic navigation indoors, typically at home and in familiar areas. So generally speaking, these are ADLs that are fundamental to the client's independence and can be achieved in short periods of time, generally within 3 to 5 lessons after a functional vision assessment. The next tier of service is specialized services, and this is really centered around achieving long-term personal goals to advance independence for those individuals with little to no functional vision. So like learning to be fully independent at home or navigating the world with skill and confidence. Our specialized services also address the needs of children, as well as adults with dual diagnosis, such as mental health, cognitive disease, acquired brain injury, chronic disease conditions, including diabetes and cardiac disease. Specialized services are delivered after an individual has completed their primary service. These services support the needs of clients who require a greater number of visits to achieve more complex goals, and can include a number of the following sort of skill sets. So essential skills for daily living, like meal preparation and personal care, outdoor travel and mobility instruction, early intervention services for our children 0 to 6, and assistive technology support services. In some areas of the country, VLRC also offers career and employment services for those clients who wish to expand their post-secondary education, get work ready, or maintain their current employment. Lastly, there's crisis response and rehab, which is offered when someone first experiences vision loss, especially if it happens suddenly and their personal safety is jeopardized. So basic daily tasks like preparing meals, climbing stairs, or managing medications can suddenly become dangerous. So our crisis response and rehab services deliver urgent in-person care to people who are in crisis. This could be because the person, as mentioned, has experienced sudden and significant vision loss within the last 2 weeks. The individual is currently being discharged from hospital or could be at high risk of hospital admission or in some cases readmission. So for these individuals, our specialists fast track the intake process and initiate crisis services. Generally, our goal is within 2 business days from the time they're referred to us, and often it involves us being part of a larger care team. So the goal of these services is to remove any immediate threats to the individual's personal safety. Just wanted to take the last couple of minutes just to talk about potential career pathways. I know we're going to be talking a little bit about volunteer opportunities, which doesn't necessarily apply to VLRC. But I think what we've learned from the speakers that came before me and those that'll come after is that the field of vision rehabilitation is highly specialized, and career pathways are tailored to specific areas of expertise. So VLRC holds partnerships with the University of Montreal and the University of Massachusetts, who offer master's level programs in vision rehab therapy, focusing on low vision therapy, vision rehab therapy, and O&M. We also work very closely with the University of British Columbia, who offers a program in orientation and mobility instruction. And each of these academic institutions require related undergrad degrees for admission. So it's common to see individuals with backgrounds in occupational therapy, kinesiology, gerontology, and postgraduate studies in ophthalmic and optometric assistance pursuing this type of career path. I should also mention that our certified staff in low vision therapy, O&M, and rehab therapy are certified through the Academy. I'm going to get this right. It's ACVREP. So it's the Academy for Certification of Vision Rehabilitation and Education Professionals, and are required to engage in continuing education and recertify every 5 years. So we are currently working on requirements for some of our additional specialists. I'll just maybe end here by saying, in recent years, we've intentionally dedicated time and resources to increasing awareness about the field of vision rehab therapy by partnering with Queen's University, the University of Waterloo, and various colleges and high schools. Our aim is to highlight the importance of vision rehab therapy, vision health, which may not be considered by prospective students. And our hope is that our collaborative efforts will educate and inspire future professionals in the field. So we continue to offer practical placement opportunities for students with any of our partnered academic institutions. And I'm proud to share that we've had 100% placement rate for all of our placement requests through those institutions, and have been successful in offering employment opportunities following placement with an 87% rate. So I'll leave it at that. I know I went a little bit over, apologies, but I'll pass it back to you.
Thank you, Bianca. And just a little bit about Bianca's background. So Bianca is the Senior Manager, Clinical Practice and Standards, and has been with Vision Loss Rehabilitation Canada for 25 years, 19 of those as a certified low vision therapist. Bianca held the positions of Professional Practice Lead, Clinical Lead, and Manager of Healthcare Operations before beginning her role in Clinical Standards. She sits on the Academy for Certification for Vision Loss Rehabilitation and Educational Professionals, Low Vision Therapy Subject Matter Expert Committee, and her local Student Education Advisory Committee as well. She is passionate about client-centered care and ensuring equitable, high-quality service delivery for our clients. Away from work, you will find her in an ice hockey arena, cheering section, or pursuing her love for traveling abroad. So thank you again, Bianca, for your presentation. Our fourth speaker for tonight is Diana Rosales from CNIB. Diana serves as the Director of Community Engagement and Inclusion at CNIB, where she is pivotal in shaping the organization's strategies for engaging with stakeholders and advancing key programs. Her primary focus is on developing comprehensive strategies to enhance CNIB's interactions with participants, donors, and volunteers. Diana is dedicated to building participant and volunteer-centric strategies that foster long-lasting relationships with stakeholders. Her leadership in the volunteer engagement portfolio aims to make CNIB the best place to volunteer by optimizing engagement and performance, and by creating a continuous learning system to enhance staff capabilities in volunteer management. Originally from Venezuela, Diana has called Canada home for over 15 years, bringing a rich blend of international experience and local insight to her roles at CNIB. And our fifth speaker for tonight is Larissa McKnight from CNIB. Larissa is a specialist in volunteer engagement and strategic projects at CNIB, where she leads efforts to support and enhance the volunteer experience, particularly through national initiatives like the Vision Mate program. Her work includes developing strategies to foster long-term initiatives, particularly through national initiatives like the Vision Mate program, impactful relationships between volunteers and participants living with blindness and low vision. With a diverse background in nonprofit work, marketing strategy, education, and community engagement, Larissa has successfully managed programs that enhance accessibility and inclusion for all Canadians. Her work is grounded in a passion for making a meaningful difference. So please welcome Larissa and Diana.
Hello, everybody. Thank you so much for the opportunity. I am Diana Rosales, and I identify myself as a woman, and I'm coming from my home office in Toronto that it's very, very cold. So bear with me while I shake and haven't get used to the cold weather yet. Thank you so much. I would like to just go over a little bit of what CNIB is and the services that we provide. So if you don't mind, let's just go to the next slide, and then we will talk later on of our volunteer opportunities. That's when Larissa will join us. To start with CNIB is a nonprofit organization driven to change what it is to be blind today. What we do is we deliver different programs and services that help our participants to live the life they dream and try to remove those barriers that they face in society. And we hope that together we can build a more inclusive Canada. And the work that CNIB does, it is powered by a huge network of volunteers and staff. We provide programs in every single region in Canada, and to deliver those programs, we rely on the support of our generous volunteers. So we are funded by donations and partnerships that we have across the country. Let's move to the next one, please. To talk a little bit about the CNIB history. CNIB was founded in 1918, so we are over a century old. And this CNIB was created in response of the rising blindness rates after the Halifax explosion, and our veterans coming after World War I. The early focus the CNIB had was rehabilitation services, literacy programs, and employment for Canadians who were blind. Around the 1920s, CNIB expanded across services across the country, offering also education and advocacy. In the mid-900s, CNIB introduced health programs and began the advocacy for public policy changes. Today, our mission is to change what it is blind through innovative programs and powerful advocacy that enable Canadians impacted by blindness to live the life they choose. And if you go to the next slide, I'm going to share a little bit about the programs and services that we provide. Okay, so we at CNIB are dividing our programs in 5 categories. To describe the screen that we have 5 icons. One is live, tech, play, learn, and work. We're trying to cover all the aspects of someone's life. And at the beginning of CNIB was very focused on services for seniors. Now we're trying to be part of journeys of our participants from the beginning. So if you're born with sight loss, we're going to try to support and provide programs from children to youth to employment and later on to retirement as well. So to talk a little bit about LEAF programs, what we do is we provide programs and services that enhance our participants' life and improve the daily living skills. We help them to set goals and achieve them and enhance their quality of life. For example, we have peer support group, we have vision-made programs that we will cover a little bit later on. Talking a little bit about technology activities and programs, we know that unleashing the power of technology just leads to have an independent life. Today, we have tons of apps and resources to help our participants to be a little bit more independent and have a safe journey. At CNIB, we teach some of this technology. We have programs that actually provide technology or support participants to have access to that technology. And it's not just like Phone Forward, for example, where we donate cell phones and tablets to participants. we also teach them to use it, because technology is as good as we can use it and how we know how to use it. Then we have play, and this can include yoga. This can include learning how to paint, cooking programs, going to camp in the summer. The play programs foster activities that promote a healthy lifestyle and give the opportunity of our participants to connect with peers and others who are also facing the same challenges and lifestyle. In CNIB Learn programs, we're focused on education and the skills that they need to participate in different activities and achieve the goals that they have for their education journey. For example, we try to foster social skills, independence, and for them to follow their careers and learn under the areas that they have interest in. We have literacy programs for kids, but we also have different groups like reading groups, book clubs, who will support the literacy through the participants' life. And for work, basically what we do is we have a come to work program where we can register participants to receive their training and that they need to be part of the workforce and be able to pursue the career of their dreams and their ambitions that they might have. So we support them to prepare resumes, prepare for interviews, and be ready for the workforce. We also have partnership with different organizations and companies across the country, like Deloitte, Microsoft, where we make sure that they include our candidates as part of their workforce and help them to understand that it's not much what you need to change in order to have this talent as part of your workforce. Let's go to the next slide, please. CNIB in 2021 embraced like a new research where we were trying to understand where we wanted to be and the type of company we wanted, the foundation we wanted to be for the next 5 years. We wanted to do a little bit of research to understand what the community needed from us. So we hosted town halls and we did a lot of research surveys to understand what Canadians with sight loss needed from CNIB. In 2023, we launched our new strategic plan called the Way Forward. In this, after all the consultations that we did, from participants and their families, we identified 3 commitments that we need to develop and where we're going to focus for the next 5 years to improve the life of Canadians with sight loss. If you please go to the next slide. So here, what we identified was the first commitment is attitude. The first pillar is attitude is everything. We know that lack of awareness about the reality of the life with blindness and sight loss is one of the things that's creating a huge barrier for our participants to be able to be included in society and live the life that they choose. So the commitment that CNIB is taking is increase the awareness and try to change those misconceptions that people have about people who have sight loss. And we're going to do that through marketing campaigns to increase awareness and understand that the issues that they're facing when we're not being inclusive, and try to promote a sense of remove that idea that it costs too much money to include or include our participants or people with sight loss in the workforce. So we want to try to help them to remove barriers, remove those stereotypes, and make sure they have the equal rights and opportunities to participate in life. We are going to try to provide them with advocacy tools so we can fight with those stereotypes and try to demand businesses and organizations to just make sure that those human rights that we have are not being violated. Our community, unfortunately, is still facing a lot of mistreatment. Like, for example, there's a lot of people who are being denied access because they have a guide dog in public spaces. So we're trying to educate, we're trying to promote what is right and what is fair for our community and change people's attitudes against blindness. The second commitment that we have, or the second challenge that we find repeatedly in our community, it's no matter where our participants are, if they are in rural areas or urban environments, it's transportation and commuting. It's really difficult for people who have sight loss. So what we're going to try to do is create a safer environments and have safe journeys from door to door whenever our participants want to be. So how are we going to do this? We want our participants to be involved in those designed and discussions that the government is having, or our public transit is having when they're creating new spaces. So we want accessibility to be thought from the beginning. We want to be part of those conversations. So when they create a new subway, a new station, you consider accessibility from the beginning and not an afterthought. We want our participants to make sure that they can navigate independently and they don't need somebody else in order to get to work or get to school or be where they need to be. So we're going to try to remove these barriers and ensure that we are part of the conversation from the beginning. So when we're designing spaces, it's with accessibility on the table. And the third commitment is our kids will thrive. As I was saying at the beginning, CNAB used to be very focused on seniors and providing programs for seniors in the past. And now we're noticing and we're hearing very loud from parents that they don't have the resources, or it's really hard to find the resources to provide their children's accessibility and what they need to be successful in their classroom and in their life. So what we're trying to do is build those relationships now with teachers and creating programs and resources that will help the parents to find what they need in order to support the education of their children. I always like to tell the story that I remember my son, he has a classmate who is also blind. And I remember when I told his teacher in a parent interview that I work at CNIV. And then she was very like, oh, that's nice. I have a student who's blind. I would love for you to give me some stuff. And I was like, what do you mean to give you some stuff? Like, what stuff? And, you know, stuff for him. And I'm like, oh my God, like you don't know much about what we do and the services that are available for you to support your student. So this is some of the work that CNIV is going to try to be doing now. And for me, like it wasn't even my child, and I was so like I want to say, no, I don't want to say offended, but like concerned about like the challenges that the mom of this child will have to go through with this teacher. So now we're trying together to let's just educate you. Let's tell the parents what's available, where do they need to go, and create those programs that will support the education of our children. The other piece that's very important with Kids Will Thrive, if we're making sure that we have access to eye checks, and we need to make sure that all our children have regular eye checks to have early detection of any possible eye disease that they might have. So it's a little bit of education, it's a little bit of working together, collaboration, and making sure that the kids has everything they need in order to succeed. And then CNIV will try to offer all those programs that will go through their life, the whole journey from beginning to retirement. And I think that is it.
Thank you, Diana.
No
Thank you to
problem.
all of our speakers. We're so grateful for your presentations and your information. I'd now like to introduce our Q&A. And we already have a question in the chat. So Anthony, so hopefully I'm saying your name right, asks, I'm wondering what is VLRC's plan for Alberta? If I'm not mistaken, Alberta is the least funded province per capita for low vision. So Bianca, that might be more towards you, but feel free also, Diana and Larissa, to chime in. Thanks.
Sure. Thank you for asking that question. It's a really good one. VLRC offices across the country in 4 specific divisions are all provincially funded through provincial healthcare. And so you're correct in stating that Alberta is our sort of lowest funded province and division across the country. We still have enough funding to be able to deliver core services to our clients who require rehab support from us. There are some gaps related to vision rehab therapy, which is creating a real huge impact from the perspective of what we would refer to as blind rehab. So the ability for us to deliver instruction for Braille literacy, anyone who's living with no functional vision and requires specialized support for ADLs. So we have been trying our best to fill that gap in terms of delivering virtual care cross divisions and in group settings with other stakeholders and community partners. While it's not as effective as us being able to deliver the services internally, it's what we're resorted to doing at this time. We continue to meet with funding partners in Alberta and continue to advocate for the importance of services for those living with sight loss. So no, it's a bit of a non-answer and not much of an update. We don't like to reference things like phantom wait lists, but we do so out of necessity to be able to gather data so that we can deliver some statistics to funders when we're talking about increasing funding asks. So still a lot of work to be done in Alberta. We're hoping it will very soon follow suit to the other provinces across the country.
This is Diana. For CNIV, we do have also programs that are available in Alberta. We rely on funding donations, but we pretty much have active all the programs that we have across the country. So Come to Work, we have it available in Alberta, and also we have now a new way to deliver programs, which we usually, if we can, in the places that it's available, we will partner with VLR, C to Deliver, which is the mobile hub, where if we don't have an office and we usually our office are located in the main cities, but if we have to deliver programs in rural areas, we will spend a day or two in specific locations. Usually we go to community centers and try to deliver the main programs that or the programs that are in high demand in that area. Usually it's technology, that's huge. Come to Work, it's a big one. So employment and technology, I would say it's the ones that we get more requests for.
Thank you. Yeah, Sanjana, please go ahead.
Hi, thank you. So I just wanted to know, what are the main challenges that you guys may face when it comes to educating the public about preventable eye conditions and their treatments, etc.?
Great question.
Oh, I can start. For CNIV, there is a lot of stereotypes. There's a lot of, and this is why I think it's part of our new strategic program. There's a lot of misconception of, because you're blind, you can't do this, you can't work, you can. So or being accessible means that you have to spend a lot of money, and so it's hard to be inclusive. So I think it's fighting against those stereotypes and trying to demonstrate that because somebody has sight loss doesn't mean that they can perform or they can do or they can follow the dreams that they have. Having to prove that with a positive message and showing what they're capable of sometimes can be a challenge. The other challenge that we always have is, funding, and sometimes we can support the awareness campaigns that we would like to, or the advocacy campaigns that we would like to support. But I think it's just fighting against those stereotypes and those conceptions that people have about people with people who have sight loss. That sometimes it becomes a challenge, and demonstrating that you shouldn't be putting a cap of what somebody can do or cannot do. That's up to each individual.
Perfect. Thank you so much.
I see here too in the chat that someone is asking about your session, Katie, where you mentioned that your group works in different countries around the world, but their question is, which country would have the most vision impairment issues? A follow-up question is, would it be a country with less medical facilities or a country with a higher population?
So that is an excellent question, and it gives me an opportunity to give you a quick lesson in public health, so bear with me. When we talk about kind of countries with the biggest sort of what we call a burden of sight loss, we're talking about something called prevalence, which is the overall number of people with mild, severe visual impairment or blindness. And so that's then looked at by population. So it's looked at as a rate or a percentage. And so I actually had a slide that I took out, and maybe I shouldn't because I thought it was like too academic, but I had a slide on like in prevalence rates across the globe, and the countries with the highest rates of visual impairment are in South Asia. So that would be India, Nepal, and Bangladesh. Does that answer your question? Yes, awesome, great. No problem.
Question. Other questions from the audience? I have a question I wanted to ask. This is for anyone who'd like to answer it. But, the issues and challenges are really different between rural and urban settings. And I think all of your organizations, tackle those challenges in different ways. I just wondered if anyone wanted to kind of speak to that. Aisha, maybe I can call on you just to share a little bit more first, perhaps.
Yeah, thank you. So yeah, there's certainly differences in the approach that we take in working in rural areas versus more urban areas. The issues that we come across, just to generalize across low and middle income countries, is in rural areas, there's often issues of transportation, distances. We don't necessarily have the same access to facilities that are close to home. People in lower economic brackets may not have enough money to even pay for that small amount of transportation to get to the facility, or there's issues with referral. So you might be able to access a community health center, or you might be able to access a local district hospital, but that facility might not be well equipped to serve your needs. And so what does it take to travel to that tertiary level facility in the city? That might be more complicated. It might compromise work. And when you consider also gender issues, the roles that a woman might play in the family and might need to be home, there's all these different considerations that make that access a little bit more complicated. Yeah.
It's Diana from CNAV. The only thing that I will add to that, agree 100%, will be less accessibility. Not that we are close to be, super accessible everywhere, but you might find more accessibility or access to accessible places in the city. Like it's amazing how even signage with Braille, which technically should be everywhere, it's not in rural areas. So that access to accessibility, or the technology that provides you the accessibility, it's kind of like more difficult in rural areas.
How about urban areas? Are there challenges that you all face in working in maybe high density urban spaces?
Yes, downtown Toronto, it's not very accessible. All the construction that's happening makes it even more difficult for people with sight loss to navigate constant change. And when we're planning cities, sometimes accessibility is not the first thought. So trying to incorporate it later, it's more difficult, and it makes it more expensive as well. Let me think other challenge of urban areas. More people, less, more waiting times to access the service. Maybe you have to wait a little bit longer to receive the service that you were hoping to get.
Yeah, it's Bianca. I was going to say that exact same thing, Diana, in that in larger urban centers, obviously we have a greater population, and so a greater number of clients waiting to access service. The other piece too is sometimes in urban centers, we talk a lot about accessibility, but that doesn't make it inclusive and equitable. And so it becomes this blanket statement that really isn't meeting the needs of everyone who needs access to infrastructure and funding and technology and building. So it's multi-layered, I think.
To just add an example. Oh, sorry.
No, go ahead, Larissa. Go ahead.
I was just going to add an example to what Deanna was mentioning. One of the advocacy campaigns that we worked on recently, I can't remember if it was in Toronto or Ottawa, Deanna, but there was those electric scooters that you can
Oh yes,
rent and then like for temporarily, I forget, they're called bird scooters or something. They wanted to come to, it was either Toronto or Ottawa. And so we really had to kind of fight against that because of the accessibility, like they're very common in urban tourist centers right now, and they present a huge accessibility risk. So that's another problem with urban centers is things like that.
There was a lot of issues, and I believe it was in Alberta actually, where there was a few incidents too, because they are available there and people just leave them in the middle of the street, and that's something that you don't know is there, and create accidents, or people just don't mind that somebody with a cane might be walking, somebody with a guide that was walking, and they just pass by really fast and can be dangerous.
Katie, did you want to?
Yeah, I would just like to add that one accessibility issue that I think is faced in urban and rural centers in several of the places around the world that have really high rates of vision loss and blindness is around sort of who is deemed worthy of getting services, as well as sort of how they're able to access them. So I would say one issue in either urban or rural settings a lot of times is, it's not appropriate for women or girls to leave the home without a male chaperone. And oftentimes all of the men are working and they have to work a lot to be able to support the family. And so it's just not seen. And oftentimes too, in situations like that, like women and girls may not be prioritized for eye care services because their role is seen as in the home and there's less kind of need, I guess you could say, at least according to sort of the cultural norms. So that's sort of an access issue, I would say, is kind of who's seen as being worthy of services and how people are able to access them as well.
Great point. Thank you. So we're going to move on to our next part of tonight's session, which is to talk a little bit about volunteer opportunities. So I'd actually like to invite you, Larissa, to come on and share a little bit about CNIB, and then I'll give space for the rest of the organizations as well to chime in if you'd like.
Yeah. So I like was mentioned earlier, I'm the specialist for volunteer engagement with CNIB. And I work on the national team, so I help take care of our volunteer programs that are run across the country. And I did see a question in the chat about the VisionMate program, so I am going to touch on that actually right now. So we can move on to the next slide, which is actually about VisionMates. So our VisionMate program is one of our nationally run programs. We have VisionMates and TechMates as part of this program. They differ slightly. Our VisionMates, so the program overall focuses on one-on-one sighted assistance. So we pair a person that is sighted with somebody who is experiencing low sight or blindness. And they usually meet around once a week for about an hour or twice a week for an hour. It's all dependent around their schedules. And so VisionMates will do things that help with kind of everyday tasks like reading, organizing, going for walks, assisting with errands. Oftentimes they'll get matched due to specific hobbies or special interests. So in the picture we have on the screen here, we have a VisionMate match, and they're actually playing what looks to be like ukuleles or miniature guitars together. So our program leads do a great job of kind of meeting those special interests or goals of our participants to find volunteers who will pair well with those goals or those special interests. Our TechMate program focuses more on the technology side, so they'll help participants learn new accessible technologies, teach them how to use smartphones or new apps and things like that. And both of these opportunities can be done virtually or in person, although the VisionMate in particular often lends itself a little bit better to in person, but it can be done virtually. That part of the program is really centered more around providing companionship. That's really one of the main goals of the program, is to help reduce social isolation as well. So we can move on to the next slide. Deanna actually mentioned the mobile hub briefly as well. But this is a new model that we have that focuses on visiting smaller or remote communities that don't have a CNIB office to deliver some of our programs. So if you're interested in getting volunteering with this program, it is usually just a one-day commitment. However, we would love for our volunteers in that area to come help out with the mobile hub every time it's in your area. But if you only have the one day to offer, that's totally fine. And again, for this program, it's just basic training on site. The types of things you would help out with is assisting with event setup and takedown, greeting participants and helping with registration and attendance, helping facilitate refreshments, provided sighted guiding to participants if needed. And then sometimes we do also have Zoom sessions, so potentially helping set up and moderate those on site as well. So that's a great, if you're looking for a more casual opportunity, that's a great program to get involved with. Because, oh, sorry, I should mention our VisionMate program. We do usually ask for about a 6-month minimum commitment. So the mobile hub program is something that's a little bit more casual than that. We can move on to the next slide. So we do, another good casual opportunity is our event volunteers. So these are one-off volunteering experiences that are offered across the country throughout the year, depending on what events we're running. We recently ran a really cool one in Toronto for the first time called Sailing on the Six. It was a Caribbean cultural celebration for the sight loss community, and they went out on a boat on Lake Ontario out of Toronto Harbourfront, and they had food and music and a lot of cultural celebration. It was a lot of fun for our participants and our volunteers. We also have coming up at the beginning of November our Connecting the Dots conference. We run this in usually 3 to 4 cities a year, as well as virtually. This year we're running them in Toronto, Edmonton, Montreal, Halifax, and virtually. So this is another great event to come out and help out with. We are currently looking for volunteers for this one. And up at our Camp Lake Joe in Muskoka in Ontario, We have a lot of great events that happen up there. Every summer we have a barbecue fundraiser. The past 2 years it's been with Cooking with Cuddy. He's come out and played music, and we've had a big barbecue with him. So that's another fun event you can get involved with. And the types of tasks you do at events like this for us are, again, just helping with setup, helping with tech, helping support any exhibitors or attendees with registration, provided sighted guiding, and then helping with serving and cleaning up meals as well. So that's another great opportunity that we have available. And we can move on to the next slide. So our guide dog program is often one that gets a lot of interest. This one is unfortunately not available in every region. Right now the program is quickly growing. So if you are interested, definitely reach out and figure out if it's available in your area, because we are always in need of volunteers for this program. And we have a couple different opportunities under this program. So we do have some longer commitment opportunities. Our puppy raiser, puppy starter, and puppy finisher opportunities are where you'll actually take a puppy and help train them to become a full-fledged guide dog. We have the 1-year commitment, which is you're with the puppy for the entire duration of their training. And then we have 2 smaller commitments as well. You can be a puppy starter, which is just the first 4 months of the process, or a puppy finisher, which is the last 6 months of the process. The first one focuses more on general obedience training and stuff like that while the puppy is still young. The second stage is more the guide dog, more intensive guide dog training tasks. And then we also have our guide dog boarders. If you're looking for more of a casual or short-term opportunity, you can sign up to be a guide dog boarder, where if there is somebody who needs to go on a trip and can't take their guide dog for whatever reason, or there is a puppy raiser who needs to go on a trip and needs care for the puppy that they're helping raise, you can take them for a short-term amount of time or long-term, depending on what's needed and what the location is. But you would essentially take over while they're away and help care for the dog. So if you're interested in dogs, this is a great opportunity to get to work with some puppies. And we can move on to the next slide. Another area to get involved with at CNIB is our community engagement or advocacy program. So this has a huge range of opportunities available: virtual, in-person, short-term, long-term. It can range from speaking in classrooms or at City Hall or to businesses, raising awareness about key issues facing the sight loss community, or it could range from things like signing online petitions to help any of our current campaigns, sending emails. We recently did a campaign about auditing public transportation. So going on public transportation and providing feedback on the accessibility of it, all kinds of things like that. So we constantly have new campaigns running and different ways to get involved. So that's another opportunity to get involved with a CNIB. And we can move on to the next slide. And then our program support volunteers. So these are volunteers who will work directly in some of our programs that are available locally. These differ from region to region what's available. These include things like working with the tandem bike program in Saskatchewan. So we have a tandem bike program in the summertime that runs where volunteers get paired up with members of the sight loss community and they go for bike rides together on tandem bikes. In Nova Scotia, we have a program called the Braille board game program, and we have volunteers that will come in and create Braille versions of board games for our participants to come in and play. Up at Camp Lake Joe in Muskoka, we have a couple programs. All of our summer camp programs you can come and volunteer with. There's a bingo program up there that you can volunteer with. And there's tons and tons of other programs available region by region. And if there isn't one available that you're interested in, we're always looking to harness our volunteers' hobbies, skills, and abilities. So if there's a skill or a hobby that you have that you think might be worth offering to our community and you want to run a program, we're always open to new ideas as well. So you can definitely reach out to us to see what's available in your region or to potentially create a new program. And I believe that was my last slide. Yes. So I just want to add, if you are interested in any of these programs, the best way to get involved is to apply through our website on cnib.ca. You can find the link there to our volunteer application form, where you can apply, indicate your interest in what areas you're interested in, and then a member from your local team will get in touch with you. Or you can reach out to me and I can help connect you with the appropriate team as well. And I can drop my it's the easiest way to drop my email in the chat, maybe. Okay.
Yeah, that'd be great. Thanks, Larissa. There's so many incredible opportunities. Thank you for sharing all of those. Anyone else wanted to also share about other volunteer opportunities with your organizations, whether that's local in Canada or internationally? I want to share one from Orbis Canada. So every year we do a couple of events called plane polls, which are really fun fundraising events and kind of just, again, advocacy opportunities. And we're always looking for volunteers to get out on the tarmac and help us fundraise and raise awareness. So I'll drop the link in the chat here. It's also a good way to meet other people who are interested in this topic and learn about aviation. And so that's a really fun, way to get involved locally. We do it in three cities every year. And next year we're contemplating a fourth. So that's exciting. Anyone else want to speak to volunteers? Okay. Well, there are lots and lots of ways to get involved. I think it was nice for us to show you a huge range of what eye health organizations do around the globe and in Canada to show that there's a need for all of you and beyond to get involved in our efforts and to support folks living with, vision loss or sight loss. So with that, I just want to thank you again to our incredible speakers and to all of you for your participation tonight. This was a wonderful event for so many reasons, and I really want to say thank you to Mesa and the team at Vision for All for introducing this idea, for asking for this, and hoping that we can stay in touch too to see if there's more overlap for potential collaborations. Really quickly, I also just wanted to share a little bit about our Orbis Future Vision Leader program. To encourage anyone who wants to sign up. It's a great way to stay involved and learn more about global ophthalmology and find ways for you to, again, volunteer or follow your passions and wherever they may take you. So you can always reach out to me. I'll put my email in the chat, or you can visit our website to register yourself. So feel free to share this wider within your networks and your communities. And we also have a little bit of a raffle tonight, which is exciting. So let me hand it back over to you, Mesa.
Thank you, Claire. So tonight's raffle, we added all the participants' name in a random name generator. So you all have a chance to win a Sony Bluetooth speaker. And I ran the generator, and the winner of our raffle is Japneet Sandhu. So congratulations, Japneet. I'll send you an email soon about details on how you can pick up your prize. And yeah, that would be it. So thank you all so much for everyone who joined us tonight. We're very grateful to have you part of the Orbis Future Vision Leaders community and helping us to continue to spread awareness on these topics. And thank you again for coming, and I hope you all have a great night.
Thank you, everyone. Have a good one. Take care.
Good night, everyone.
Bye-bye.